I would like to welcome you to yet another episode of the Healthcare Leadership Excellence Podcast. We really appreciate you taking time to learn, and today we are going to learn. We have someone that is an ace at artificial intelligence, and what I love about it, she's been with tech before tech was tech. And she knows inside and out, and what she adds to it is she's she's in nursing. She knows what it is to be bedside. She just has so much to share. And I would like to welcome our guest today. She just got named as a Life Fellow with HIMSS, which is one of the elite organizations of technology. And she's a professor at American University. She's San Diego based. And I would love to welcome to our program today Professor Linda Macomber. Linda, welcome.
Oh, thank you so much, Carl, for the opportunity to have the conversation today. Looking forward to it.
So we spoke yesterday this is to our listeners, we spoke for about half an hour just to delve into what would be a best benefit. Um, Also, Linda is the creator and editor of the Renaissance.health resource, and we're going to go into that. In fact, let's start off with that, Linda. Tell us about this platform you have designed, the reason behind it, the thinking behind it.
Sure. I think many look at AI as being a revolution, and I hear that term at times. I prefer the term Renaissance because it's a time after the plague in Europe. There was a Renaissance. I think after COVID and the pandemic that we can create a renaissance for humanity, starting with our health. The foundations were, I simply needed a place to keep all of the dynamic resources available to graduate students. Professor of practice at National University, and we really value the practical examples and keeping things current. Our graduate students are typically working professionals in the field, and although there's the time tested capabilities, bringing the course to life from a multimedia rich perspective, from a current case study perspective, demonstrations of software. There's really a need for a living, learning laboratory. So beyond, necessarily a textbook, to be able to, and come to bring many of the incredible podcasts, the YouTube videos, the demonstrations, many of the current capabilities in digital health come from a lot of different sources. And so I'm like a museum curator, finding great stories and putting them on the Renaissance.health resource. It has several hundreds of videos and lots of different articles, and whether it's something, a great article, it gets lost sometimes in only posting it in social media. So to categorize that from an individual versus a professional versus here's resources that are specific to AI, and then with AI needed to be, there's a whole creativity festival of to being a creator as well as a user of these digital systems.
So, just a question on your platform, is it pay subscription or is it free?
It's
How
free.
So I can log on there and put in search words and bring up a whole slew of resources. That's what you have?
Abs-
Oh,
yes,
my.
absolutely.
So to our listeners, it'll be in the show notes. Renaissance.health.com or org.
Just renaissance.health.
Okay.
The focus is on health.
What a treasure trove. Thank you. So just a question, why do you think that so many people are so overreactive to the AI? I mean, I just hear so many people that they're wary of it, that it shouldn't be there, that it's dangerous. and yet you are just a huge fan of it. Explain why and why we shouldn't be fearful.
Well, I feel a tremendous blessing that I was introduced directly from Marvin Minsky, one of the founders of AI in the 50s. I got to know him in Boston in the 1980s with his book, The Society of Mind, and became very enthusiastic about the pathways to possibilities and the potential. I think some people consider themselves optimists, other people pessimists. I think that I consider myself a possibilist, and I like looking at what we can do. And so the possibilities are just endless with what we have with these new capabilities with generative AI. So I think if anything, it's underhyped, and I think that we're just tapping the beginnings of these capabilities.
So we talked about yesterday, and I want to dig in a little bit more because you talked about these new horizons on the intersection of health and technology. I think some of us saw it on in early April. Oh, just a quick example. In late 2019, I was working with a large California organization whose boss of the organization, he was CFO, said, Carl, our organization, it is impossible. And you're just going to chuckle at this one, Linda. We cannot do remote. We need to be in the office. And of course, 4 months later, one sweep of the pen by President Trump at the time put us all remote. And then within 2 weeks, his organization was doing quite well with telehealth, hundreds, if not thousands of visits. They did 2,000 telehealth visits in 2019. In April, they did 20,000. So, with that necessity there, they did it. Talk to us about some of the new horizons you see could be possible so soon as we marry those two aspects of health and tech.
Well, I've lived at that crossroad of health and technology for over 40 years, starting as an ICU nurse and then working in Boston in the 80s. So when it comes to what occurred with COVID, I like to think it's truly just reimagining care delivery and leveraging digital capabilities. It's not really about what the tech can do, it's what we can do. And so I think if we hadn't really advanced many of our patient care systems with the electronic health record era and meaningful use, I- where would we have been when COVID hit? And I don't think we would have been in as good of a place. It's not like that light switch just turned on overnight. There was tremendous preparation over decades to help us to enable that to be possible. A lot of foundational work that occurred. For example, I worked with the Department of Defense and the original design team for the CHCS system in the 1980s. And included in that, we had, video connections between Hawaii and San Diego and had, telehealth working. And that was in the 1980s. So I think that it often takes, so many years from the great ideas to evolve into the place where they're having impact for more people. And that's why we need great leaders to see that the opportunities and to help to encourage the adoption and use of them in practice.
So, I was sitting in the airport last week and looked down this row of seats, and there was not a single person that was not either on an iPhone or a cell phone or a iPad. I'm an Apple user, so I will say iPhone and iPad locked to their screen. And they know how to scroll, they know how to send Instagram, they know how to use all these platforms. And yet, when you talk to them about digital technology, there's deer in the headlights. So, I want to just have you give us a little walkthrough. Talk to me as if I can use my cell phone, I can use my computer, but how do I really leverage these digital technologies, not just putting something in ChatGPT, but really leverage for the benefit of my own learning and for the benefit of my patients?
Well, I think I could write a dissertation on what's possible here, but how to get started sometimes and address some of the fears. And I think one way is sometimes by looking back, it helps us to look forward. And I've like sharing a little bit of Back to the Future, perhaps, of the foundations that enable us to move forward. But certainly, one example is, just simply being able to speak. And many people are fearful of AI because they feel like, oh my gosh, I have to go and learn everything about how it's created. But you can also just simply dive in and have that culture of curiosity to give it a try. And one way, a simple way, is by downloading any of the AI apps and talking with them as if you are speaking with an assistant. Because the AIs have learned English as well as most other languages and dialects on the planet and different education levels and can do the translation. And so I think that each of us has an assistant in our pocket, as and to simply have a conversation and ask it as and so that's one way to start. And the other is also to move beyond the current widespread use of ChatGPT and realize that there are new models that provide sources and references, and the era of the reasoning models has begun with AI. And it much comes down to how you are asking these systems. And so coming up with better questions, using the conversational capabilities of the system to engage and help you to learn better questions and to engage more with the system. And as you do that and help others to do that, and we all learn together, that I think that the fear subsides then because you realize it can be helpful and the balance comes to light.
Are there tutorials out there on how to phrase questions in an AI mode? Are there ways to learn that, or is it just experiment?
Well, there certainly are a varieties. I've worked on some AI curriculum at National University, and I teach healthcare information systems to graduate students in healthcare administration, public health, nursing, and data science. So that, but I think that there's also a lot you can augment the professional learning capabilities and credentials with your own experiences. And so I have a lot of fun just leveraging what I know about healthcare to assist family, friends, students, to really just get behind the wheel and start driving yourself.
So you mentioned this recently or just a few minutes ago, and I want to hit it again. Leveraging the past for the future. And you talked about in our pre-call some of the early thought leaders around AI. Can you share a couple of those insights?
Well, I think you can define AI in many ways. So certainly some people think of it as more the generative AI era of ChatGPT, November of 22, but certainly there were foundational systems back in, like, for example, the Department of Defense worked with many thought leaders on that project to launch early expert systems, that they were very deterministic and you programmed in the rules for a lot of clinical decision support systems. I worked with Kaiser Permanente in the early days of designing the systems and requirements that led to the Health Connect system for Kaiser, and they were an early client for Epic, so much of that got built into Epic as well. And so, but it's only as good as the information that's it's fed. So yes, you can have the internet, but one thought leader of mine was Don Lindbergh, the director of the National Library of Medicine. I, had the wonderful opportunity to hear him in early in my career and be inspired, and that really sort of led to my moonshot of the transition from growing up in Michigan and University of Michigan to Boston and then California, to work with thought leaders that had worked literally on the NASA project. So how fun is that to, kind of have a moonshot? But healthcare in many ways was harder because of the complexities of human lives that are involved. And so when it comes to Don Lindbergh shared and simple wisdom to take all of the medical libraries of the world and to digitize them so that we could access them more easily and the current information, and then to do the same with all of our health and patient care information, and then the brilliant wisdom to connect the two. And that's what I think we're still working on today, and that AI has enabled us to take that to the next level.
And I think segueing off that comment, I loved your phrase yesterday of being a pioneer in a modern day setting. Because generally, I know instantly, just because of some upbringing stuff, when I hear pioneer, I'm thinking covered wagons, I'm thinking 1800s, I'm thinking the Oregon Trail. And so, and your comment yesterday about, again, the moonshot and that wonderful movie, Hidden Figures, about these incredible, brilliant women behind with chalk and a chalkboard with no hardly any computation because it really wasn't invented yet. So talk to especially those that are listening that may be just in the first years of their career. Talk to us a bit about how you encourage your students to be that pioneer in a modern day setting. I love that phrase.
Yeah, I guess I believe where the preparation, sort of meets those possibilities. So it is not just luck, but a little bit of probabilistic perspective added to it. And so I, from my perspective, I had a background in nursing and working the University of Michigan Medical Center and the Harvard Medical World of Boston. And it was just so both of those environments were very much focused on innovation and research, and but technology was also launching in front of us in Boston in the 80s. And the Mass General had launched the MUMPS programming language, and was finishing graduate school and then able to really do what I hope that our future students, listeners, and early careerists have the opportunity to do, which is almost like an internship in many different areas versus necessarily just only an overly specializing. Because I do think that we need people that are cross pollination of cross-functional perspectives, interprofessional. So, and for example, being a pediatric ICU nurse, you really get to study all of the ologies because the sick kids have, you're immersed in cardiology, gastroenterology, et cetera. And then working with information systems as a consultant adopting systems. It was kind of a bit of the Wild West of systems that you're saying, not with a covered wagon, but the ability to spend time with lab, pharmacy, radiology, and inpatient, outpatient, ER, OR, across all of those different areas so that you can then progress. And so when opportunity comes, for me, it was the SAIC, and they were wanting to integrate systems to be much more patient focused and not departmentalized. And so if people had experience in lab pharmacy and radiology, you're able to put together the order systems, the plan of care systems that truly were foundational to what many have today.
So I know we have a good chunk of listeners at a couple of universities that I've worked at and that I even attended and went back to some alumni events. So let's talk to the maybe sophomore or junior who's listening to this and thinking, okay, professor, what courses should I head toward that would apply to a field that is changing overnight every night? What would you say, Carl, go do this, avoid this, anything on just general curriculum that a student or even a mid-level professional that wants to go back and get a little sharper? Thoughts on that?
Well, I, I, I think it comes down to a belief in general education and curiosity, and oftentimes innovation lives at the crossroads of several different disciplines. So, an example is if you're interested in technology, also dive into some healthcare courses. If you're interested in being a physician or a nursing or other healthcare professional, take some electives with a focus on AI and technology and how you might potentially be able to reinvent and redesign and advance human health and care delivery. And so I think that ultimately follow your curiosity in addition to acquiring one specialization. I guess I would encourage at least a couple. And then the broad integrative learning and in addition to only a specialized approach.
Excellent. I want to switch lanes for a few minutes. You talked yesterday about on our pre-call on virtual care, and I may have written it down wrong, but the gist of it was, and this just intrigued me, finding the diagnosis for something that has never been diagnosed before.
Well, I think that many are using the AI to cut costs or look at efficiencies from a little more of an operational perspective. And that's great. There's the ambient clinical intelligence helping out physicians and nurses so that we can leverage human speech to get the information in. But what I'm excited about goes beyond that, where I'm seeing early diagnosis, much more proactive care, starting with the imaging systems that can identify cancer, for example, earlier. Looking at, they're enough of those early case studies. I chaired the Davies Award for HIMSS, really loving to find those early identification of innovation that's working that can be so exciting. And so, an example are the diagnoses that different specialists may have not yet put the puzzle pieces together in the
Mhm.
same way. Some of our systems are very siloed and we have wonderful healthcare, wonderful specialists. But I think that the AI can help us not just in efficiency but at reducing errors of commission, but errors of omission. So oftentimes there's that entrepreneurial mindset of, identifying a problem and solving it, but sometimes you can identify before it becomes a problem and solve it, because the AI can see what we can't see yet. And so to tap that opportunity, and then also to personalize and individualize care. So imagine if we're not treating diseases as much as truly we're healing people. And that takes that whole human approach. My university, National University, likes a whole human perspective on education. And the equivalent, there are many parallels of technology in healthcare and in education. So when you look at what can we do, not just doing the same old things better, but what can we
Yeah.
do that we really couldn't do before, but now we can? And so many of the areas, whether it's finding all of your digital twins or people, like me. And, what different treatments have they done? What outcomes have they had? The example is like the Epic Cosmos system, the new platform from Mayo Clinic platforms, where you're able to bring in the genomic data. You can bring in a whole lot more than what we have in our professional EHR healthcare systems. But truly, to have a movie camera of our health versus lots of snapshots and pieces that we're trying to pull together, and truly have that, I guess it's like a magic button, the best care choices for my patient. That ultimately is taking the legacy, looking back, of Don Lindbergh's, vision in the 80s to connect the National Libraries of Medicine and, personalize and connect that with all of our own health information to come up with more informed choices, more informed decisions. That's redesigning care, that we bring care to people, that people don't necessarily need to go to the facilities as much because that wisdom can be shared more in a distributed way. We can reinvent the way our workforce is addressing care, and make sure everyone is working at the top of their license as well. So there are just a lot of possibilities.
Yeah, and I love your phrase, be a possibilist. I like that. We, again, referring to our conversation of yesterday, your level of entrepreneurial thinking intrigues me, and you've done it for decades. It goes to your phrase about being curious. And so, what I'd like to dig in on is you have worked at many levels, you have led at many levels. You don't get the HIMSS award for just sitting in the background. Talk to us a bit about the importance of entrepreneurial thinking, but even more deeply, critical thinking. We mentioned that phrase yesterday, and we hear about that, but could you define that for us as a professor as you work with your students? What is critical thinking in your view, and how can I learn it and practice it?
I do believe that our graduates have the skill set to be more curious. I think that it goes beyond almost even critically analyzing, because you don't want to get stuck with analysis paralysis, but instead to look at the sources. And fortunately, the newer AI models do provide sources, and that's a huge differentiator. So it's not just to accept, for example, with what ChatGPT comes up with. Because it can be wonderful with its imagination, it can actually create statistics that don't exist. It can create, references that don't exist. Um, or you can be smarter in the way that you're tapping these new capabilities. So someone who has more critical thinking, that's graduating from a graduate degree program, will look at those sources. Like a physician and nurse are going to not just accept something for a patient, they're going to look at where is some of the evidence-based practice. But what's exciting about adding some of the new AI capabilities is the ability to also look at what I call practice-based evidence. So someone needs to be first. So, how do you include that in sort of that traditional mindset of many healthcare professionals? Like, hey, you may not have that double-blind placebo-controlled study yet. And guess what? That study might not be as individualized. For whatever reason in my DNA, it's that study just doesn't work. And so I think that we're at a crossroad of capabilities to help leverage these new AI models together as we would request information from an additional consultant. So being a little bit of a skeptic, I think responsible use of AI requires critical thinking. It requires not just accepting anything that you read on the internet or anything that the AI comes up with, but instead you apply it, use the human wisdom to say this can help. I think leaders are challenged with when should we use AI in digital systems and when should we not? That may be the quintessential question to ask ourselves as leaders, because the priorities are what we need leaders to come up with. And that requires a lot of thinking, a lot of analysis, a lot of different perspectives. So, kind of looking beyond just our knowledge base to respect and include all of the perspectives at the table, and to leverage AI to help us provide additional perspectives.
Absolutely. So I wanted, as we head into the last part of the interview here, I still have a lot more questions. I know that just in healthcare, there is an ever-growing population of brilliant women. You started in the field when women were not included, and you were many times the only woman in the room in in your tech work. There was still a lot of hierarchy in the medical world, and most of the hierarchy was not female. Could you give some words of guidance to those women who are listening to us today and thinking, wow, how did she do it? Did she navigate what could have been a lot of discouraging situations? Yet, as we talked yesterday, and as I hear you talk today, you don't seem to stay too stuck on the discouraging. So, give us a little coaching there as to, yeah, it was, and this is what we did, and now here I am.
Well, I'm a believer in meritocracy, and it isn't as much about being male or female or different perspectives. I think it's about bringing your unique perspective to the table, and realizing that your perspective, it could be very different than other people, and sometimes that can feel very alone. But other times you're like, well, wait a minute. What would what would things be if you didn't provide your perspective? Would some decisions be made that maybe aren't the best ones? And so it's so important for all of us to speak up. I think maybe it's just the American spirit, freedom of speech, and it's the confidence to contribute even if the world knocks you down. And I think whether or not you're male or female, there are going to be times when, healthcare is receptive to research and innovation, and it's always been cyclical. Sometimes when, boy, the technology is going to save us, and it's like, oh no, we can't afford it. And it's so important to leverage both your perspectives, your career, as well as tech and AI in general, as a part of the answer, but not all of it. And so it can be the the right timing sometimes when you're knocked down. I've been knocked down, and then 5 years later, someone comes up with the exact same suggestion, and it's just saving the world, right? And it's like, oh, just bad timing. And but to keep trying and realize that, I guess earlier in my career, I've had the sense that others would simply be excited about innovation, and it took a while to realize, no, not so much. Some people are really wonderful at being the brakes, but truly you need the accelerator as well as the brakes to safely launch new initiatives into healthcare and respect those perspectives. So I would encourage, just simply better listening, I think, if I could talk with my younger self.
And one more item about the younger self in our discussion yesterday. You talked about being an early adopter. Talk to us about that.
Well, I think it's fun to try new things. And it's important when you're launching new ideas into healthcare is to find other people who are also interested in giving it a try. Um, and it's so much easier then to share stories of here's what I did as a physician, as a nurse, as a respiratory therapist, and here's what worked for me, and then sharing that. So certainly for startups, it's so important to get started with actual care providers. They're wonderful innovation centers at major academic medical centers now, which I think is wonderful to help to get started so that you don't go too far focused only on the product versus emphasizing the process and the people perspectives. It some call it change management. I really prefer just focusing in on people process as well as the technology and the connections of how it works. And
So we talk about the 5 generations in the work site, and we have, just to dive in, millennials who are tech savvy, Gen Z who know nothing but tech since they have been, I mean, they were the first generation to be born with a screen, and brilliant minds in that regard. We also have people that are in the boomer category that still would prefer not to have a lot of technology around them. If you were speaking to somebody who just isn't getting the picture of what AI can bring because they may just be uncomfortable with it because of age or exposure, what would you say to them to get them riding this wave that is not going to go away?
well, I believe meeting people where they're at. And it's not, what's the matter with you? It's what matters to you. So focus.
Quick timeout. You've got to say that again because people are listening to you as they drive and they can't take notes. You said something that is gold. Say it again, please.
Oh, well, oftentimes we focus so much in healthcare on what's the matter with you. But imagine that, people are not a diagnosis. They are not a problem list. They are not, the diabetic in room 20. It's instead, let's have a conversation about health priorities. And that's a very different conversation. So, as you can become CEO of your own health and be digitally and AI empowered with a lot of information and resources and your life, having that conversation about priorities with your healthcare professional, that's where ideally you have not just a one-on-one necessarily, but it's a team, and you include AI capabilities as part of that team. And each have pluses and minuses. AI can make mistakes, but so can humans. I think that if we realize, just like any leader creating a great team, here's what different people can do well and contribute, and encourage us to use all of the people and all the technologies that can help. There are a lot of challenges in healthcare to address, and ultimately, if we can tap into that, we can provide, really, all the chronic diseases of healthcare, right? I mean, of too costly and not enough access, not enough interoperability, not identifying things soon enough that they can be addressed. All of those things, we can address all of them.
Absolutely. So, if they're listeners, as I know they are out there thinking, well, I want to know more about Professor Macomber. I know we have Renaissance.health. Where else can they reach you, pick your brain, read what you've written, learn from you? How do they access or Professor Macomber?
Sure. I mean, I'm active on LinkedIn, and so Linda Macomber at LinkedIn, and also through National University. And I started healthcare technology consulting 30 years ago now. So the links to Renaissance.health include kind of some fun stories of my moonshot and other areas if on the about page. And you can look at some of what I've created with AI, from songs to videos and writings and such on the Creativity Festival, to hopefully inspire others to take some of these systems for a test drive.
It has been a delight, Professor, to have you with us today. Thank you so much for taking the time. Really appreciate it.
Well, it's been great. Great to thank you so much again for the opportunity.
Absolutely our pleasure.